why these freckles are occurring. What is the difference between a freckle and a nevus? Both are pigmented, but what is the difference between the two? The thing is, the number of melanocytes in the basal cell layer are not increased in number in the case of the freckles, whereas they are increased in the number in the case of the nevi. That's a major difference. Why they are very pigmented is, though the number is normal, the amount of pigment of melanin produced is more. So that is the cause for the freckles, ephelites, is what I want to underscore to all of you. Now let us talk about this important condition called the lentigo simplex. It is very similar to freckle, but the thing is, here both the number of melanocytes and also amount of melanin in each melanocyte also is increased, is what need to basically remember. Typically they are the flat brown lesions which are commonly seen in the elderly individuals. They develop on the dorsum of the hand, on the face, so that is the lentigo simplex. But the good news is they are generally benign. They won't turn into malignant melanoma, is what I want to underscore to all of you. An average dermatologist will be approached by a lot of patients. They are all worried basically about that melanoma. They are not worried that cosmetically it is dark and all that. They are more worried, is it going to become malignant melanoma? You can say it won't become. The lentigo simplex will not become. Now let us talk about this nevus. Basically, nevus is a benign tumor of the neural crest derived cells. It contains modified melanocytes of various shapes which are called basically the nevus cells, is what need to basically know. There are different types of nevi. You have nevocellular nevi, junctional nevi, intradermal nevi, and so on. Which nevus predisposes to the malignant melanoma? Let us look into it. Generally, the nevocellular nevi begin in the early childhood as junctional nevi. What do you mean by that? There is one epidermal component, there is a dermal component, it is existing at the epidermodermal junction, so that is the junctional nevi. It contains a lot of pigmented nevus cells which will be proliferating in the basal cell layer. They will be flat and they will be pigmented. That is all the story about this nevocellular nevi. Then later on, the junctional nevi develop into the compound nevus. Once it extends into the underlying superficial dermis, at that point of time it forms a lot of cots and columns of these nevus cells. So that it will have two components. One is the dermoepidermal junction, it has got one home, and later on it extended into the intradermal component, so it has got an intradermal and a junctional component. Two things will be there. Once this junctional nevus becomes a compound nevus, no more it is that flat lesion, doctor. It is now a raised lesion, a verrucous lesion, a highly pigmented lesion. Is the compound nevus, is what I want to underscore to all of you. Now you can see how a flat pigmented spot which is found in the forearm of a 40-year-old man, and he says that this is present for the past 25 years. What speaks about the benign nature of this junctional nevus is the pigment contour is even. It is not irregular contour, and it does not have any variegated appearance. That is somewhere more thick, somewhere less thick. Such kind of appearance is not there. So a uniform color, uniform contour characterizes a junctional nevus which is flat, which is not raised. The moment it becomes raised, you need to worry about, and you need to go for a cancer screening, is what you need to basically remember. And on the puberty, the junctional component is lost, and finally only the nevus cells remain within the dermis, and then it is called as the intradermal nevus, which is the most common type of nevus that you come across in the adults, is what you need to basically remember. So a junctional nevus becomes a compound nevus with a dermal extension. Later on it loses its epidermal, that is dermoepidermal component. Finally it becomes intradermal by the time the individual becomes the adult. Then what is this dysplastic nevus? There will be numerous nevi which will be developing over the entire body, and if you take a cut section, those cells will have a dysplastic appearance. And dysplastic nevus you need to worry because it can predispose to the development of the malignant melanoma, is what I want to underscore to all of you.